If you're dealing with sciatica, you know that the idea of an epidural can feel like a light at the end of a very long tunnel. But then you're faced with a choice, and suddenly it gets confusing. So let's jump right in and clear up one of the biggest questions you're probably facing. Yeah, does this sound familiar? You go in thinking it's a simple choice, only to get hit with these complicated medical terms. It's super frustrating, but trust me, you're definitely not the only one who feels this way. And that's exactly what we're going to do in this quick explainer. We're going to slice right through the medical jargon so you can walk into your doctor's office feeling way more confident and ready to be part of the decision. So let's get right down to it. At the heart of this whole thing, the choice usually boils down to two different types of epidural injections. Understanding how they're different is really the key to everything. Yep, these are the culprits right here. These are the two words that cause all the headaches. They sound super technical, I know, but the idea behind them is actually way more straightforward than you'd think. It all comes down to the path the needle takes to get the medicine where it needs to go. So here is the bottom line, and it's actually pretty simple. The big difference isn't about some fancy technique. It's all about one thing. How precisely can we get that medication right to the nerve that's screaming at you? Are we sniping a specific target, or are we covering a wider area? That's the whole game. Okay, to really nail this down, let's use a super simple analogy that I think makes this all click. Just think about it like you're trying to find a house in a new neighborhood. Okay, so imagine your spine is a neighborhood. A transforaminal injection, that's like taking a very specific side street to get directly to one single house. That's your irritated nerve. The interlaminar injection, on the other hand, is more like the main road. It's designed to serve the entire neighborhood, delivering that medication to a broader area. So this is our side street approach. It gets its name because the needle goes through something called the neural foramen, which is really just a natural opening on the side of your spine where the nerve root exits. It's all about being as targeted and precise as possible, getting that medicine right up close to the source of the problem. And then we have our main road, the interlaminar approach. This one comes in from the back right in the middle, between the lamina. And the lamina are just the bony plates that make up the roof of your spinal canal. This path lets the medications spread out more, which can be exactly what you need when the pain is a little more widespread. All right, so we've got the what down. But now for the big question, right? The why. How in the world do you and your doctor figure out which of these routes, the side street or the main road, is the right one for you? This chart right here is basically your cheat sheet. So, over here in the transforaminal column, this is for when your pain is really specific, like a sharp line of pain down one leg, and your MRI points to one single spot causing all the trouble. That's when that targeted side street makes a ton of sense. But on the flip side, over in the interlaminar column, the story's different. Maybe your symptoms are broader, or on both sides. In that case, the main road approach might give you that wider relief you're looking for. I absolutely love this quote because it just says it all, doesn't it? This isn't about which procedure is newer or more advanced. It's about listening to the story your body is telling through your symptoms in your MRI and then picking the right tool for that specific job. Okay, look, any medical procedure comes with real-world questions, right? So let's talk about the stuff you're probably thinking about. The risks, the side effects, and of course, what's this all going to cost? So the good news is that for both of these, the most common side effects are pretty minor, and they don't stick around for long. You might have some soreness right where you got the shot, or maybe even a short flare-up of your pain before the medicine really starts working. But these things usually clear up in just a few days. Now, there are more serious risks, and they are rare, but we have to talk about them. But listen, the answer here isn't to get scared, it's to get clear. Ask your doctor, how do you minimize these risks? Make sure they're using imaging, like an X-ray, to guide the needle. And definitely talk about your own health, like if you have diabetes or are on certain medications. All right, let's talk money. And the honest answer here is, it's all over the map. In the US, your out-of-pocket could be hundreds or even over $1,000. It really just depends on your insurance. In a place like South Korea, the national health system covers a lot, but you'll still have copays. So here's the single most important piece of advice I can give you. No matter where you live, always ask for a written estimate beforehand, period. All right, we are on the home stretch. We've gone through the what, the why, and how much. Now, I want to give you the single most powerful tool you can take with you to that doctor's appointment. Here they are, your 3 essential questions. First, what exact nerve root are we targeting, and why are we sure it's that one? This makes sure everyone's on the same page. Second, what's the specific safety plan for me? This makes the risk conversation personal. And third, and this one is so important, what does success look like for me? This isn't just about a pain score. It's about being able to walk your dog or sleep through the night again. It sets a real-world goal.
Susie, you can totally stop worrying about which injection is better. That's the wrong question. The right question is, which one makes the most sense for my body, my symptoms, and my goals?
You do it by asking the right questions, by understanding the simple logic behind the complicated words. You do it by shifting your goal from finding some magic bullet to simply making a smart, informed choice with your doctor. That is how you own this decision.